TMT class, my name is Krisy, as some of you know, and I chose a topic that isn't mentioned once in our book. In fact, healthcare professionals are usually not formally educated on my topic of choice at all. This has led to a lot of misinformation and, sadly, poor quality of care. I'm talking about providing care and treatment for the marginalized transgender population. Consider this a crash course, a Trans 101, if you will, along with the do's and don'ts when interacting and treating a transgender patient. Now, onto a video that will shed light on why this is important.
My name is Cecilia Chung. I am a resident in San Francisco, and I am also a commissioner on the San Francisco Human Rights Commission. I had a bad experience in hospital when I first began my transition. I had really severe abdominal pain. I went into the emergency room. They immediately dismissed my symptoms. I overheard the nurse calling me a drama queen. They did not give me any really complete examination and decide to discharge me. They actually escorted me out with a security guard.
It's a sad reality, but LGBT people still face discrimination in healthcare. A study by Lambda Legal in 2010 reported that 56% of lesbian, gay, bisexual patients and 70% of transgender patients experience some form of discrimination. These patients are reporting being refused healthcare, blamed for their health status, subjected to harsh treatment, and physical abuse. The fear of discrimination or discrimination itself lead LGBT people to avoid seeking healthcare, and as a result, healthcare disparities are rampant in the LGBT community.
I endured another long week of excruciating abdominal pain. I went to the emergency room again, to the same hospital. They found out that I actually had developed gangrene already at that point. Had I not gone into the emergency room at that 11th hour, I would have died.
There are things you can do to protect your healthcare rights. Plan ahead. If there is a hospital that you frequent, check out their patient's Bill of Rights. If it doesn't include LGBT protections, ask them why. Make sure you complete your hospital visitation forms and keep them in a safe place where they can be accessed in an emergency. Complete advanced healthcare directives and make sure that your family knows your healthcare wishes. Also take a look at the hospital visitation policies. Again, if they don't include LGBT patients, ask them why.
I've become more proactive in my own healthcare. I decided when I choose my primary care providers, I made up some questions that I was going to go through. I asked them about their experiences in treating transgender patients. And that's how I was able to found this wonderful relationship that I have with my primary care provider, and she's been my doctoress for over 10 years now. I think it would definitely be helpful had the Healthcare Equality Index been around at the time when I had all my challenges with the emergency room services. It would give me the tool to really advocate for myself at the time when I needed it most. The message to all hospitals, it's really basic. They shouldn't be looking at people because of their skin color, because of their sexual orientation or gender identity. They should be treating people because they are there to save life. It's their job. When they take their oath, they have taken an oath to save life.
Now it's time for a Trans 101 crash course. I'll begin by talking about sex and gender and taking a look at a handy-dandy diagram called the gender donut. Sex and gender are independent from one another. They don't have to match in the ways that society tells us they do. Sex is about biology, and gender is about who you are and how you identify. Sex and gender are often talked about as binaries, each with only two choices, man or woman, masculine or feminine. In reality, they are each a spectrum in which people can land on any number of points. The genderbread person is going to help me explain further. Gender identity is how you, in your head, think about yourself. It's the chemistry that composes you, like hormone levels, and how you interpret what that means. Gender expression is how you demonstrate your gender, based on traditional gender roles, through the ways you act, dress, behave, and interact. Biological sex refers to the objectively measurable organs, hormones, and chromosomes. Female equals vagina, ovaries, XX chromosomes. Male equals penis, testes, XY chromosomes. Intersex equals a combination of the two. Sexual orientation is who you are physically, spiritually, and emotionally attracted to, based on their sex/gender in relation to your own. Now that you have a better understanding of what gender expression, gender identity, biological sex, and sexual orientation are, and how they all interact, it will be easier to understand what transgender means. Here's a lengthy definition that incorporates everything you've learned so far. Transgender people are those whose psychological self, meaning gender identity, differs from the social expectations for the physical sex they were born with. To understand this, one must understand the difference between biological sex, which is one's body, and social gender, which refers to levels of masculinity and femininity. Often, society conflates sex and gender, viewing them as the same thing. But gender and sex are not the same thing. Transgender people are those whose psychological self differs from the social expectations for the physical sex they were born with. For example, a female with a masculine gender identity, or who identifies as a man. So what are the do's and don'ts when treating a transgender patient? I'll tell you. Treat transgender patients as you would treat any other patient. Honor the patient's preferred gender identity and use the pronouns and terminology they prefer. If you're unsure of the patient's gender identity or the pronouns you should use, don't make assumptions. A simple, "How would you like to be addressed?" or "What name would you like to be called?" will work. Focus on caring for your patient. Don't ask questions out of curiosity that isn't related to the treatment you need to provide. Just as you wouldn't disclose a patient's HIV status to anyone who doesn't need that information in caring for them, don't disclose a patient's transgender status unless it's pertinent to the care they require. Don't ask about the patient's genital status if it's unrelated to the treatment you need to provide. And lastly, remember that a transgender patient's body may have elements, traits, or characteristics that don't conform to the patient's gender identity. Their anatomy doesn't define them, even though that anatomy may require treatments that are typically provided for persons of the opposite sex. For example, if a chest exam is needed and breast tissue is present on a male-identified patient, address them with masculine pronouns and his preferred name. So there you go, folks. Now you know how to treat and care for transgender patients.